Hi, my name is Pat Veling. Welcome to the website of Dr. Ron Barbanell and his staff. I'm excited to be here because I've known Ron personally for 25 years, and I'm here only as a friend of Ron's. I'm not being paid for this. I'm simply here to talk to Ron about what makes him so special, frankly, and about why his practice has changed the lives of so many dental implant recipients, some of whom you'll meet today with your visit to this website in other videos that we've got available for your viewing here. So I'd like to take a minute and introduce you to Dr. Ron Barbanell, and he's going to tell us a little bit about what makes him and his practice so special. Ron, I'd like to start with the fact that you have a mission about dentistry and dental implants in particular. Tell us and those who are visiting your website about your mission.
The mission that I've had as a professional for all the years I've had it is to try to provide a service that's useful to people. And in health, one of the big obstacles for people is to take advantage of the technology that the profession has created and break down obstacles such as cost of care to make that technology available. The particular area I'm interested in as a periodontist and an implantologist is placing dental implants. I've tried to figure out a way how I can make dental implants affordable to people. I've done that by learning to be a skilled implantologist, learning how to do surgery quickly and effectively, learning how to buy materials, how to make relationship with other vendors, the lab technicians, the dentist I use, the laboratories that process our appliances, and the vendors who sell our implants and related supplies. So I have a team of people who I work with to help make dental implants affordable. And I think that based upon my experience, we charge anywhere from less than a third to a third of the prevailing rates. We do a lot of implants, I do, my staff does, every day. And I think we have happy patients that we provide affordable quality care to.
You know, a common theme so far has, in addition to the affordability of these dental implants that you're so good at, has been function. I think a lot of what your website visitors will see in these videos is a very common theme, that many people feel that their implants are as good, if not better, than their natural teeth. Tell me about how that comes into play with your practice.
Well, I listen to the patients that you spoke to today, and a very common theme is they don't know that their implants are there. They can't distinguish from their natural teeth, and many times even the people who clean their teeth can't distinguish. Mm-hmm. They're not aware of the implants being there. The procedure itself doesn't require anesthesia, usually doesn't require more than simple x-rays, oftentimes doesn't require sutures, oftentimes is a bloodless procedure. We do many patients, and that's one of our missions, same-day dental implant service. A person comes in, generally with 1 or 2 or 3 or 4 implants, not a complicated treatment planning situation, and we can do the implants the same day. I literally have people coming from all over the country in that sort of situation where my staff are able to help them.
Mm-hmm. And in talking to some of your patients who've been living with these implants for 25, 30, 33 years in some cases, all singing your praises as the practitioner and singing the praises of their dental implants. Is that a common sort of thing that the average patient can expect? A 25 or 30-year lifespan of a dental implant?
Well, actually, the first person we saw today, her implant was placed 37 years
30,
ago.
okay. Thanks for correcting me.
I did that at USC when I was still learning how to do implants. Mm-hmm. I think that once the implants have healed after a year, you can't promise this legally, but I think most people have their implants all their lives. They do require maintenance, but this is a long-term service that we're able to offer. You know, an interesting question you asked as far as mission. A lot of people come in and they really can't understand why the fees are so much less. I've heard many, many times, if it's too good to be true, it's probably not. And there's a section on the website called affordable versus expensive implants. What's the difference? If you look at the breakdowns of the cost of implants, it's what the dentist chooses to charge themselves per hour. That is the main cost difference between implants. I've put down that I think, quite frankly, I probably make $800 an hour. There's some dentists making thousands of dollars an hour. We live in a society where you're entitled to charge what you think you're worth. But we also live in a capitalistic society where there's the opportunity to get second opinions, look for alternatives. The web has been a wonderful opportunity to tell my story and give people the options to decide based on experience and cost what service they want to obtain.
And what's been fascinating to me in hearing these stories is a very common theme that many of your patients have actually become friends, because that's just the kind of guy that you are.
Well, socially, I'm probably not the best husband, father, son. But professionally, my patients are my friends. My life is my practice. And I was interested when I was watching the interviews today. Did you notice how many people called me by my first name?
Almost all of them.
Yeah, I don't generally call all my physicians by their first names unless they ask me to. My patients are my friends. I think oftentimes even in the first visit, where I'm doing implants the first visit, I try to make a connection. It's not contrived. It's an important part of what we in health call the art of caring. I enjoy doing that. It's my life. You know, you asked about my mission or purpose. One moral and ethical decision I've made is to make sure that the care that I recommend is appropriate. I say in the website, if it isn't broken, don't fix it. You heard Peggy say today, he doesn't do what doesn't need to be done. All these patients we're talking about, they really could trust me. Lots of people who come in, I tell them they don't need implants. They don't need to lose their teeth. And that's very important to me. In fact, sometimes I feel the best, even though I'm not going to make anything, where I can test my own integrity and say, you know, I thank you for coming, but you really don't need my services.
You know, you've just heard a very spontaneous, transparent, and from the heart honest discussion with Dr. Barbanell, who, as you also heard him say, has a mission to change the lives of his patients through appropriate care, the right science, the right level of caring that he extends through his staff and his practice to his patients who are now friends. The wonderful thing about the web, and Dr. Barbanell's website in particular, is that it's full of resources and an opportunity for you to explore the idea of dental implants and learn how you can also have a positive life experience through working with Dr. Barbanell to be sure that your dental implant experience is the absolute best that it can be. Do your research. We invite you to visit other websites of other practitioners. Visit the expensive Beverly Hills cosmetic surgeons if you choose. I feel pretty certain, as Dr. Barbanell's friend, that you'll end up understanding yourself that the absolute best value, the absolute best care, the absolute best investment that you can make in yourself will be dental implants with the help of Dr. Ron Barbanell.